everyone, this is Dr. Alalade and I'm your admin here at AsktheGynaecologist, and welcome once again tonight. Tonight is going to be a wonderful one because we are doing simultaneous broadcast on Instagram and on Facebook Live so that everybody can partake in this discussion today. Once again, I want to welcome you all. I know you've been obviously busy all day today and you're here to join us. So if you have that time to join me, I'm happy for you to be here. And once again, I'm your host here. Today, I'll be talking about the causes of prolonged penile erection, problems with penile erection in teenagers. And it's going to be a fascinating topic. It's going to be wonderful. It's going to be very, very, detailed. So if you're free, join me and let's have this discussion. And if you're watching me over there on Instagram, thank you once again. And I'm hoping that my audio is good. So I got to check my audio quickly here. If you can hear me well, please give me some thumbs up where you are. And if you can't hear me well, let me know so that I need to check my audio and ensure that my audio is good. Once again, this is Dr. J, one of your admins at Ask the Gynaecologist, and tonight I'll be talking about problems with penile erection in teenagers. So if you're free, join me. I know everybody had a wonderful weekend, and today is a special day for women. Today is the International Women's Day. So if you have a woman in your life, and I'm sure that definitely everybody's got a woman in their life, women that have been tremendously influential, they've changed your life one way or the other, you need to celebrate such women, because everybody at some point, we all pass through a womb. We all pass through someone's womb to be here. Our first real estate in this world, our first accommodation in this world was someone's womb, and that person definitely is a woman. It does not matter how you came into the world, whether you came to the world by C-section or by normal delivery through the vagina. We all pass through someone's womb. So we need to celebrate women in our lives, and that's what we do here at ATG today. We're celebrating all the women all over the world that has been wonderful, and they are still doing wonderful things to raise children, to raise champions, and to raise wonderful people to change the world. So if you're a woman, if you're a lady, you're watching me, obviously, I celebrate you, and we all celebrate you here in ATG. My name is Dr. Alalade, and I'm one of your admins at Ask the Gynaecologist. And ATG, if this is your first time in ATG is the largest group on Facebook where we discuss detailed things about female gynecological health, and there's no group in the world today that is as big enough as ATG, and we are doing tremendously well here, and we're bringing new things to you. And you're well aware that we have a new IVF center which is going to be ready around June, July, and it's going to serve one of the largest metropolitan local government areas in Nigeria, in Lagos. So if you're in Lagos, you get ready, get set for that amazing time coming up soon. So tonight, without wasting too much time, I'll talk about these things, okay? Somebody asked me a question today, right? That, doctor, what could be the problem? Why teenagers have problems with erection? Why would teenagers have erection problems and they are suffering from erection and it's a big deal? So I chose that topic as a topic today to clarify that detail. Sorry, my hands are very white. Obviously, I'm just coming from surgery and theater. So, in surgery, you wash your hand all the time. And sometimes we forget to, cream, but that's it. So, welcome once again. And if this is your first time joining Ask the Gynaecologist, I want to welcome you. You are where you're supposed to be. If you're a woman, you're a lady, if you're going to join any Facebook group, it's ATG. You should be here because you'll be learning a lot. And I can tell you, for people that have been here for almost a year, 2 years, 3 years now, they've known tremendously far better. And I'm sure by the time you're talking to your doctor, you'll be talking with education, with clear facts. And a lot of the times, people talking to me, and they'll say that whenever they were seeing their doctor say that, come, how do you know so much about the female body? And they tell them, I've been on ATG. That's a testimony. If you walked among us, if you've been among us, you will be a different woman today. You know more about yourself. That one is no doubt. And that is my joy, that every woman that passed through ATG is far better in the way they talk, in the way they interact, in the way they show forth knowledge amongst their friends in the mosque, amongst their friends in church, amongst their friends at work. They know that they've been on ATG. So thank you once again for people that are sending their testimonies to show forth the things that you've been learning in ATG. Thank you so much. So today, now, obviously, it's obvious, it's well known that teenagers these days, right, they use so many substances, okay? I'm not debating whether it's right or wrong now. Obviously, it's dangerous to the body, it's wrong. But that's not what I'm saying. I'm trying to show that people taking opiates, all those funny chemical, all those science students, these things, if you're taking them, if you know anybody taking them, let them know that they're going to do damage to their system, to their nervous system. And by doing such damage to the nervous system, to their kidneys, it will affect their erectile function. You see, the mechanism, okay, of the way the penis gets erect and relaxes is an hydraulic mechanism. Okay, take it from me. It's my business. I'm a doctor, it's my business, right? The mechanism of a man getting erection is similar to the hydraulic system. Okay, is similar to hydraulic system. Okay, if you've seen, if you're an engineer, you're working in engines, you'll have noticed that whenever you want to, maybe all those engines that move, they move like caterpillar, all those things, they even the brakes, they function by fluid system. You pump some sort of air into the compressor, it compresses the brake is firm, they can move, take topsoil, do heavy lifting. They are all hydraulic system. Fluid is anything that can flow through any confined space. Air is fluid, water is fluid, blood is fluid. They all obey the law of fluid mechanism. That is physics. Everything that flows, okay, whether gas, whether fluid, as far as or whether water that flows in any confined space is fluid, and they all obey what we call Pucell's law. That's physics. Forget about that. But blood is fluid, okay? So the mechanism of erection of the penis getting erect is through fluid system, is through hydraulic system. Take it or leave it. Okay, so blood must flow for penis to be erect. If blood cannot flow, if somebody has problem with the blood flow in their penis, blood flow in their veins, in their arteries, they're going to have problems with erection. So erection is standardly governed by the law of fluid dynamics and fluid mechanism because it's blood. If blood cannot flow into the penis, it won't be hard. It will lose erection. And if blood flows there and flows out too quickly, it will lose erection. So the way the penis gets erect is that when blood flows into the penis, okay, there's another system, what we call the cavernous system in the penis, that restricts the blood flowing out. Okay, the longer you can restrict the blood flowing out, the longer you can have erection. Okay, so what are the things that teenagers can do that can affect their erection? Now listen, people taking opiates, all those science students smoking all those shisha and things, they're gonna do damage to the system. People jumping together, codeine, mashing them up, mixing them with different substances and smoking such things, it affects the penis, it affects erection. Obesity, children staying at home, on the computer, on the system, they're not exercising. Obviously, because of COVID, these days, people are not that mobile. They're going to cause so much heat down below. It will destroy the sperm. Teenagers wearing tight clothing that are not 100%, it does not allow air to flow, to blow into the erect scrotum. It destroys the scrotum. It destroys sperm. Okay. Sometimes people too that are sicklers, okay, they're taking medications and so on and so forth. Sicklers too also have problem, what we call priapism, where they get erection and they can't lose erection. Okay, and there are some science students too that will take some different concoction of different Igbo. Those things to contain substances too that can cause priapism. Priapism is when a man has erection and the erection cannot go down. It's standard like congeal like that, it won't go down. That's what we call priapism. Okay, so if you get erection and the erection is sustained, it doesn't go down, it's priapism. Okay, some medications, sicklers, you can have and develop that problem. Sicklers are people that got sickle cell gene. They can have erection, and sometimes it causes persistent erection and becomes very, very painful. And in such cases, it's an emergency. We need to relieve such blood flow out of the penis so that sickler patient can lose the erection and they will not, so that they don't damage their penis. Okay, so priapism is sustained erection that becomes a problem. People losing erection very quickly is another kind of problem. It's another spectrum problem. In between is a balance. Now, what can make these things happen? Apart from people that so now I'm dealing with two things here now: the priapism, sustained erection causing problems and damages to the penis, and also people that cannot keep their erection because of so on and so forth. So people using illicit substances, right? Whatever they're using, they can cause both. Illicit substances, recreational drugs, all those funny things that are gotten illegally, they can, smoking, all those things, they can cause priapism and they can cause loss or lack of erection. So if you're a young person, you got teenagers around you, you need to educate them on these matters, that these things can destroy the kidneys, they can damage the nervous system, and they can affect their erection in future. In fact, it can cause sometimes impotency. So it's very, very important. So someone asked me that question today, that what can cause these things? This is the reasons why, and that's the reason why I came out today to talk about this important thing that could be a major problem amongst our teenagers. I know obviously these days now we can't move around because of COVID. We can't do our normal physical activity. So obesity is becoming an issue around, definitely. But despite that, we need to keep on. And if you look at the way it is now, people are allowed to walk around, exercise, walk around, okay, to keep their body moving. Obesity has a way it causes increase in temperature in the scrotal area and it can destroy sperm. And this applies to even adults too. Sitting down watching Netflix 24/7 has dangers that can can cause increased temperature, increased heat in the scrotal area that can damage the sperm production too. And these things too can cause secondary infertility or even primary infertility. We need to keep moving. The body is designed, human beings are designed, nature is designed to keep things moving. Things that don't move is not good. Everything in the body, outside the body, must keep moving. Rivers must keep moving. If it doesn't move, it becomes a dead sea. We keep breathing. If you're not breathing and it becomes stagnant, and the hair in our trachea becomes stagnant, it causes pneumonia. We must keep peeing. If we don't pee, our pee is stored in the bladder, it becomes urinary tract infection. Things are designed, blood that does not move, that becomes stagnant, can cause embolism that can be fatal and can kill. So we are designed to be moving. We are designed to be moving. If we don't move, we start to die. So if you're on that bed, you're on that chair, you're not going to, you're not moving around, you need to get your bum up and move around. Exercise at least 3 times a week. A regular exercise for minimum of 30 minutes, ensuring you sweat, okay, is very, very important for the heart, for the lungs, for the body, and for you to keep fit. People that are very fit perform well in bed. So now, I'm going to open the floor now to questions now. I know people are watching me on Instagram, on Facebook. You're going to have questions now. You can ask me, and I'll take you through the questions and I'll answer the questions that you might have from there. Okay, so I'm all yours now. You can ask me any questions you have. And I will take them. So I can't see comments yet. So if you're already asking questions, I can't see comments yet. Okay, now I can see comments now. So Angel Emeka, Umeo Jiaka, good evening. Amanda Chuku, Ella Chini, wonderful. Elizabeth Ifediba, thank you so much. Blessing Kiru Uba, Tony Sandra Igweonu, and my boss, Dr. Queen. Dr. Queen is here. Is my wonderful boss, Dr. Declan Queen, wonderful gynecologist there, and he's here watching us live. Thank you so much, Dr. Queen. I really appreciate you. Ola Inka, Anibi, Carol Kings, Cecil Brown James, Bumi Ajayi, Bumi Banki, or Sadia. So welcome, and thank you, Elizabeth, for putting the link up there. I'm open to questions now. So if you got questions, ask me. Let's trash them. Let's pieces them so that we might and then I'll clock out on this page. I want to quickly answer that question for that lady that asked that particular question regarding erection amongst teenage boys. So Tony Adeloye and Ejoke Eyeregba, thank you so much. And Mashallah Basirat, I can see you there for posting. Thank you for posting the link for the March seminar, March ATG seminar. Nonso Esomono, thank you Nonso, and Eke Noela. If you're pregnant, you want to, Dr. J, at what month can anomaly scan be done? So this is Naimeka is asking, Naimeka Ekeze, normally we do anomaly scan. And what is the purpose of anomaly scan? Anomaly scan is to detect any obvious, bodily malformation, structural malformation in the baby's bone, in the unborn baby's body. Now, so when we do anomaly scan, usually it's done between 20 weeks and 22 weeks. Anomaly scan is essential for anybody that is pregnant. When you're 20 weeks, before your 22 weeks, that 2 weeks gap, you must do your anomaly scan. And what are we checking for on your anomaly scan? We're checking that the brain is well developed, all the cerebellum, the pons, the cerebral hemisphere. We're checking the heart, that the heart is structurally normal. We're checking the lungs too. We're checking the kidneys, the stomach, and essentially we run through all the exoskeleton, the vertebra, that is to say it's well formed. That is the purpose of your anomaly scan, minimum. Okay? And anomaly scan is even much important, especially if you're diabetic, especially if you're obese, especially if you've got children before that they've had problems with maybe some syndrome or some abnormality. So for such people, it's even more important for them to do anomaly scan in pregnancy. But you must do anomaly scan in pregnancy regardless whether you have this sort of history or not. Anomaly scan is to detect any structural, physical abnormalities in the unborn baby. So what is Esther is asking, is pregnant care start taking from 3 weeks of pregnancy? No. So if you're pregnant, you should be taking your pregnant care, obviously, 3 months before you get pregnant. But even if you've missed that, some people get pregnant without them knowing or planning for it. If you're pregnant, from the day you know you're pregnant, start taking your pregnant care, if possible, to minimum 12-13 weeks of pregnancy. If you want, you can take it all through pregnancy, no big deal, but you must take it to at least minimum 12-13 weeks of pregnancy. Good evening, sir. Please, if someone has follicular cysts of 16 millimeters, does it mean the person didn't ovulate that month? It doesn't mean so. No. Follicular cyst is not your dominant follicle. Follicular cyst is different from dominant follicle. Okay? Follicular cyst is a simple cyst. It's a simple cyst. It just comes and goes. Follicular cyst is different from a dominant follicle. Dominant follicle, you want them to be at least 12 millimeter or more. Follicular cyst is a simple cyst. It's a physiological cyst. They come and go. Okay? Don't mix it up. Dominant follicle is different from follicular cyst. Okay? Is pregnant care good to start taking from 3 weeks of pregnancy? Yes, Esther Eke. You can take a pregnant care from 3 weeks of pregnancy. It's okay. Doctor, can one ovulate a day after period? It's possible, but it's very, very unlikely. It's very unlikely for you to ovulate a day after your period. It's possible though. I won't say it's impossible. We never say it's impossible in medicine, but it's very, very unlikely. Good evening, doctor. Please, sir, I've been given birth to 3 girls and I want a male child. What can I do? But if you want a male child, 100% to get a male child, you have to consider IVF with gender selection. Such things are not done in such part of the world here. You have to do that in Nigeria if possible, and then they go through gender selection stuff with you because it's unethical in some part of the world. Okay, so you can get that done. Janet Kennedy, you can get that done in Nigeria. Thank you. Good evening, Dr. J. Okay, I've done that already for Nnameka Keze. I've answered question to Esther. Okay. Adesoji Alukofunke Akpanisile. Thank you so much. And thank you so much, Elizabeth, for sending that link. Faith Sampson, thank you for joining us. And Esther, okay, you blessed. God bless you too. Thank you. Thank you. I'll take more questions before I log out on this page. So that you don't spend too much data. First of all, I want to say thank you for coming out to listen to me, for spending your time, your data to listen to me this afternoon, this evening. I really appreciate you. And thank you so much. Viviane Idiabe, thank you so much. Viviane Idiabe, good evening to you. A wonderful lady. Peace Oyemide, you're where and you're welcome. From our people watching us on Instagram, I want to say thank you and welcome once again to this show. My name is Dr. Alalade and I'm one of your admins here at AsktheGynaecologist and I'm here for you. Hope Ashdela Jonathan is saying, what causes premature ejaculation? How can it be tackled? What are the negative effects of using over-the-counter erectile medications? Premature ejaculation is primarily caused, okay, usually from stress. The number one cause of premature ejaculation is stress, okay. Maybe you're afraid, you're afraid that the girl might change his mind. You want to quickly do your business. You can have premature ejaculation. For people watching lots of porn as well, it can lead them to have this kind of desensitization and leads them to having premature ejaculation. If you're watching porn too much as a guy, you can have a problem called premature ejaculation. Now, number 2, premature ejaculation can also happen too from overexhaustion. You're tired. You've done so much in the day. you're exhausted from work, it can make you so fatigued, and you can suffer from premature ejaculation as well. Now, people not doing adequate foreplay, it can also cause premature ejaculation too. Dr. Alalade, you're doing a great job. Thank you, Nibi. Now, how can you tackle premature ejaculation? If you've attended any of my Friday masterclass talking about sex, we did that from August last year to December last year. We did it for 6 months last year. Every Friday we're talking about sex and how to improve sex life. I've spoken to us in terms of things we can do to ensure that we can last longer in bed. Breathing technique, start and stop, adequate foreplay, eating lots of fruit, drinking lots of water, avoid being over full from meal before going to do action, okay, and also taking things slowly. So all these are packaged in a sex PDF video class which you can get. It's a 1 hour long training, so watch that video and get more information. I have a question from Nifemi Adebola. She's saying on Instagram, is it possible to get pregnant naturally with blocked tube? Very unlikely. If your tubes are blocked, if both tubes are blocked, so these are the tubes, okay, like the hams moving into the womb. If both tubes are blocked, there's no way the egg released from the ovary can enter through the ostia here to pass through the tube and get into the cavity of the womb. So in such a case, we have to use IVF, but there's nothing God can do. But it's going to be very difficult and a challenging thing for you to get pregnant if both tubes are blocked. I have a child since 12 years ago. Since after giving birth, my period has stopped till today. If you had no period for 12 years or so, first things first, if you're trying to get pregnant, it's all basic. We should minimum do all your hormone profile to know whether you're still ovulating or not. Basically, your LH, FSH hormone, D21 progesterone, and let me go through them, okay? If you get them done at the ATG Laboratories, it's going to be free consultation for me, from me. So you can get all your tests done at the ATG Laboratories, and then the lab manager will tell you how to get the results to me, and I'll review them for you free of charge, okay? You've challenged, I don't know what this is. Doctor, can regular sex cause waist pain? No, regular sex does not cause waist pain. I wish all the magical women happy Women's Day. Thank you, Cecile James, my wonderful sister. She's here wishing everybody happy International Women's Day. So Baby Man next is saying, Doctor, what causes blocked tubes on Instagram here? Blocked tubes is usually caused from infections that were not treated, that were not properly treated, that were missed, or that were not totally treated. Any infection, any bacteria in the vagina that can move into the womb cavity and can damage the tubes. If you don't treat infection on time, adequately, okay, and you keep on having infections repeatedly, the more infection you have, the more damage it causes to your tubes. So if you add one infection, it will cause damage to your tubes. You treat it, it's gone. You have another infection again, it will cause more damage to your tube. You treat it, it's gone. The more infection you have, the more cumulative damage it will cause to your tubes, okay? So be careful. If you're not sure of that guy you're dealing with, use condom to protect yourself, okay? Good evening, doctor. Is it possible for someone that has one tube to conceive naturally? Yes. If you have one tube that is perfectly okay, you can get pregnant, because as far as you have one good tube, okay, and you got ovaries, it does not matter which ovary ovulated that month. The tube that is okay has the power to pick up the egg from either ovary that releases the egg, okay? But obviously, if you have two normal tubes functioning, 100% capacity. But if you have only one tube that is functioning, maybe the other one was removed for a topic or for any reason. As far as you have one tube, okay, it gives you chances of pregnancy from 100, it drops to 67%. Okay, so if one tube is damaged, your chances of getting pregnant naturally falls from 100 to 67%. Okay, right. Thank you so much. I am Jeffrey 4 for that question from Instagram. Adesoji Aliko is focused asking, can the baby gender be selected, and what is the probability of this? You can select baby gender, but it has to be done consistently through IVF. There are also other things you can do to calculate your ovulation to know which day of your cycle to have sex, to get pregnant, to have your particular gender. But those techniques are not 100%. To get the particular gender, you have to go through IVF, to be honest with you. And it's not 100% guarantee. With IVF and proper experience and skills, chances of getting your particular gender goes up to 90%, but it's not guaranteed 100%. Okay, now I got a question from somebody again. Same Alisoji. How long can one conceive after removing IUCD? Once you have the IUD out, you can conceive anytime from 3 weeks onwards. Okay, can there be delay after IUD removal? Yes, there can be delay to get pregnant after IUD removal, but it's very, very rare. It's what? Very, very rare, except you have other problems going on. Once you remove the IUD, usually from 3 weeks onwards, you can get pregnant. Thank you so much, Adil, for asking that question. Somebody's asking, Ifi Nina, what causes repeated infection? It's the same thing as what caused the infection in the first instance. The number one cause of infection in the vagina is obviously having casual short-term relationships, okay, and not protecting yourself. Number two, obviously, the vagina is like an open wound. Every woman's vagina is like an open wound. It should be treated as such. You must treat your vagina and make sure it's clean. Don't put stupid things in your vagina. Maggi, curry, garlic. Don't put any nonsense thing. Your vagina is not a cookery pot. Don't put any of those things in your vagina. Keep it as it is. Okay? So number one cause of infection in vagina is obviously casual relationship. If you have changing sexual partners 3 months to 6 months, you're changing all the time, you're going to increase your risk of getting an infection. In such a case, I'll suggest if you're not sure what you're doing, then use condom or abstain if possible. So if you have infection over and over and over again, you're going to increase your risk of having infection. Sharing sex toys too increases the risk of infection. Okay? Sometimes the way your personal hygiene, the way you treat yourself, you look after yourself, your personal hygiene too can increase your risk of getting infection too. So can blocked tubes be flushed, sir? Yes, it's what we call, this is from Instagram, hydrotubation. With hydrotubation, you can flush the tubes, but it only works 25% of cases. 1 in 4, 1 out of every 4 do we succeed in flushing the tubes. Thank you so much for that question, Omotolani from Instagram. And how can it be done? Tubal flushing can be done by the doctor in the theater. We use fluid under high pressure to pass it through the cervix into the womb cavity and intend the fluid flows into your tube to unblock any blockage in your tube. But it only works 1 out of every 4%. And one out of every 4 people. Thank you, Envy or Mogara. If you leave IUD for a long time, can it cause infertility? How long can you keep IUD? There are many types of IUD. We have what we call Mirena coil. I used to have one around here, sample for teaching. I don't know what that is now. Okay, yes, I have one here. There's one I got from the from training that I had years ago. So Mirena coil, I don't know where it is anyway. Mirena coil comes in this tiny this, you can see this one here is not for use in humans. It's for it's a demo piece I got during the training. So my Mirena coil comes in this kind of device. It's mounted very tiny, very tiny. Okay, we insert it into your womb this way, and then we release it, and it flies in, and we remove this one out. Mirena coil can stay in your womb cavity for up to 5 years if you want to keep it in. Once you want to get pregnant, you can take it out. The coil is somewhere in my office here. Okay, yeah, that's it there. That's the Mirena coil. So Mirena coil comes like this. You see, you can see it in the womb cavity. You can see this thing. That's the Mirena coil. This is the exact size, exact life size. It's as small as my finger. Okay, so the Mirena coil stays in your womb cavity like that. Okay, and whenever you want to get pregnant, we just pull the thread like this. It comes out very easy. It stays in the vagina for in the womb cavity for up to 5 years. Okay. We also have the copper coil. I don't have that sample here. The copper coil can stay in your womb cavity for up to 10 years as well. Okay, for up to 10 years as well. Especially if you're more than 45, you can keep the copper coil in for longer. Okay. Now, but if you keep your Mirena coil for in more than 5 years, it does not do any job. It becomes a nuisance. Okay. So sometimes too, if the Mirena coil is not fitted in by an experienced person that knows how to fit the Mirena coil, they can put it in a they can put it in a false passage that can cause infection, can cause damage, and can cause all sort of nonsense. Okay, so Mirena coil must be fitted in by someone that knows and is very skilled in fitting the coil in. So That's Marina coil. It works for up to 5 years. The copper coil can stay in for up to 10 years, especially if it's fitted in once you are above 45 to prevent pregnancy. Okay, and that's it. And once it's out, after about 3-4 weeks, you can easily get pregnant. Okay, and don't leave a coil in for longer than necessary. It can cause other problems too. Definitely, if you're not in a regular relationship, using a coil is not the best for you, because that coil we put in, whatever coil we put in, we always keep the thread there, because we keep the thread there so we can pull the coil to remove the coil. So if you're not in a regular relationship, you're not using protection, you're not sure of your spouse or what he or she is doing, you're not in a regular relationship, that thread itself can be a real track for infection to go in from outside inside. So for you to consider using a coil, you must be in a stable relationship. If you're not in any stable relationship, coil is not the best thing for you. It's not the first thing for you. It should be the last option for you. You should consider other forms of reliable contraception for yourself. Okay? Now let's take another question. I can see people are watching us from Instagram. Thank you so much. Alaja Z, Ogo Mrs. Can fibroids cause blocked tubes? Fibroid is unlikely to cause blocked tubes, but yes, if you have fibroids, okay, around the opening of the tube into the womb, and the fibroid there can cause obstruction to the tubes. Yes, it's possible, but it's not very common. So fibroids can obstruct the tube, can cause blocked tubes, can obstruct the entrance of the tube into the womb cavity, but it's not very, very common. Okay, but theoretically, fibroids can cause blocked tubes if the blocked tube, if the fibroid occurs at the entrance of the tube into the womb cavity. All right. Yes, Rosemary Chima Fatui. We have an ATG laboratory. Yes, in Lagos mainland, and Elizabeth has already put the address of the laboratory up there on the screen. And if you want to do any of your hormonal profile, fertility test, ultrasound scan, you can easily call Nike, the lab manager, tomorrow. Yes, they are closed now, and she'll talk you through what you should do, how you should get there, and how you can get all your tests done at the ATG laboratories. And I said again, in fact, if you do all your tests for your fertility hormonal profile test, for infertility test at the ATG laboratories, I'm obliged to review your results. So Nike will give you out to get across to me with your results, and I'll review them. I do that all the time. It's not a big deal. Okay? So once again, I want to say thank you everyone for attending my talk today. I really appreciate you, and I want to say God bless you, and have a wonderful day, and have a wonderful rest of your week. God bless you. See you soon. And also, I want to say, trust me, I love you all, and I love myself too. Have a wonderful day. Bye-bye.